No oil. Here we go. The average cholesterol, when we started with that earlier, that first group was 237 milligrams per deciliter. And over the next 5 and 12 years, they were able to keep the total under 150. And the LDL was right around 80. And this is the levels at which they had wonderful things happen. Now, I do want to share with you at this point some angiograms of these patients, which happens to show disease reversal. And these angiograms were reviewed in triplicate by senior technicians in the Cleveland Clinic Angiography Core Laboratory, who do this all day long for national medical trials. So when I give you a percentage of improvement, I know that it's accurate. This happens to be a 67-year-old retired pediatrician, and you are looking at the left anterior descending artery. And from the arrow on the left to the arrow on the right, it was a 10% improvement, which is about as small as the naked eye can see. It's easier to see in this next one, in this 58-year-old factory worker, where you're looking at the circumflex artery to the back of the heart that was measured from the arrow on the left to the arrow on the right as a 20% improvement. Wait a minute, now we got to get something going here. There we go. Here we have a 54-year-old security guard. And this is the right coronary artery. And from the arrow on the left to the arrow on the right, this was described as a 30% improvement. Now, this young gentleman is Joe Crow. He's in the first chapter in my book. He is a surgical colleague and a friend. At age 44 in 1996, Joe began to get chest pain. He was not hypertensive. He was not diabetic. His cholesterol was 156. He was not a smoker. He had no family history. He exercised regularly. Chest pain. So he was worked up by cardiology in October of 1996. They could find nothing that was seriously wrong. And a month later, in the third week of November, he had finished his surgery and had sat down to write postoperative orders when suddenly he felt the elephant was now sitting on his chest. Pain in his left jaw, left shoulder, and arm. He was having a heart attack. They whipped him down to the catheterization laboratory. They start the catheterization, cardiac arrest, resuscitate, finish the catheterization, one more cardiac arrest, resuscitate, stabilized, finally set up to the floors, and then discharged 3 days later, but very depressed. Why was he depressed? He was depressed because at the time of his catheterization, the entire lower 1/3 of his left anterior descending artery, this widowmaker, was all moth-eaten and diseased, as you can see around this yellow bracket. And you just can't pound in stent after stent after stent. And it was too far down the artery for a bypass. So he was very depressed about this. And Ann and I had Joe and his wife out for dinner 2 weeks after his heart attack. Joe, come on. You've been eating this horrible Western diet, and you got the typical Western disease. We've got 10 years of data. Why don't you think about going plant-based? He said, okay, I'll give it a shot. They really couldn't offer me anything else, but I'm not going to take any of those statin drugs. I don't trust them. Fine, that's your call. He became the absolute personification of commitment to whole food plant-based nutrition over the next 2.5 years. And then he had another angiogram. Now, up in the surgical office areas, our doors are about 3 doors apart. And I found myself at noontime on the day that earlier that morning, Joe had had his follow-up angiogram. I walked over to his office, let myself in, and there he was sitting behind his desk. I said, Joe, I'm aware that you had your follow-up angiogram today. Mind sharing with me? How did it go? So he got up from his desk, came around, put his arms around me and said, I think we're doing okay. I said, well, would there be any chance that I can see the follow-up angiogram? And he said, sure. Now, that's pretty remarkable. And the body, when the plaque is young, and the patient seems to be young, the body, and the plaque is made up of inflammation, fat, and cholesterol. The body can do an amazing job of actually getting rid of it. Now, on the other hand, when the plaque has been there for decades, and it's made of fibrosis and scar and calcification, it's unlikely that you're going to get much of it to go away. But on the same time, it's going to be my job before we wrap this up today to show you why it is that even those older patients where this plaque may not go away are going to get back to full activity of daily living without restriction. Now, again, this next one is another young person. This is a 45-year-old gentleman from there we go. 45-year-old gentleman from Florida who in July of 2017 had a heart attack. And as you can see where this arrow is on this particular artery, that was described as an 80% narrowing of this artery, which is a branch of the obtuse marginal, which goes to the back of the heart. Now, this patient had other blockages, which really had the cardiologist advising that the patient have bypass surgery. But the patient said, no, I've read this book, Prevent and Reverse Heart Disease, and I'm going to try to do it with diet. And the cardiologist, of course, said, well, this will not work. So it was a year later that he had followed the Prevent and Reverse book, and they had another angiogram. And lo and behold, it was no longer 80%, it was now 40% blocked. Well, at this point, the patient changed cardiologist, and his new cardiologist, a year and a half later, wanted another angiogram. And at this point, now it was completely gone. But the point that I think I've always been trying to make, because this data is absolutely so exciting and so provocative, and is so empowering to patients. This patient had absolutely no assistance from any physicians to make this decision. The cardiologists were against it. And I think that really the data is so overpowering. The epidemiological data of the multiple cultures that don't have this disease, and how we can often see striking examples of disease reversal, I think it's totally appropriate that every patient with this disease ought to be offered the option of getting rid of their disease. Now, on the other hand, let's go back to the study. There were, of those original 24 patients, there were 6 patients I knew within the first month. They were nice guys, but I had no money for this study. And they just didn't quite understand about plant-based nutrition. So with their blessing, I referred them back full-time to their expert cardiologist, and they became sort of my quasi control group. And over the next 12 years, 2 of them died, and then the others had the cardiac events that you see here of disease progression. On the other hand, of the 18 patients who stayed with us for the full 12 years, I wanted to know, in the 8 years prior to coming into our study, while they were in the hands of expert cardiologists, They had 49 events of disease progression that you see listed here. However, once those 18 patients came into our study, over the next 12 years, 17 of them had no further events. We did have one little sheep who wandered from the flock at about 6 years, got into the French fries, lamb chops, glazed donuts, more angina, had to have a bypass, but now has come back with the flock and proves the point that I'm trying to share with you today. Now, as excited as I was in the results that we had with this original group of patients, we were highly criticized. Dr. Esselstyn, this is a very small study. Dr. Esselstyn is not compliant. It's not really randomized. And that's what makes you, and it's your diet is so strict. It's rather severe. And I always take objection to that because to me, the most severe diet available to the American population is the one that guarantees that roughly 98% of Americans are going to get ill from it. I think that's the radical diet. I don't see how you can call a diet that gets rid of the disease anything but exciting and wonderful. But nevertheless, we were criticized and said, what makes you possibly think that you can repeat this study with a larger group of patients? And would you be able to get similar results? So we did. This was published in the American, this was published in the American Journal of Family Practice in 2014. This was 198 patients. And of those 198 patients, 89.3%, almost 90% were adherent in our follow-up of close to 4 years. There were 21 who were non-adherent. And it was rather interesting that when people say that patients won't follow this diet, why is it that we're able to get 90% to follow? I think if you're going to have a patient make this sort of significant lifestyle change, and it is significant, I won't for a moment say that it is not. It is severely significant in terms of a change. But if you're going to have a patient do this, you've got to show a patient respect. And the only way that I know to show a patient respect is to give them my time. So I will share with you that still once a month, I conduct a intensive counseling seminar. That's one day, it's 5.5 hours. Usually we limit it to about 18 to 20 patients. It's obviously during the pandemic now, it's all done virtually with Zoom. And patients are going to learn all about how they have created their disease and precisely how we are going to empower them as the locus of control to halt and reverse their disease. Now, that's not all that we do because, as I mentioned, it's so important to show the patient respect by giving them our time. Every one of those 18 or 20 patients, my secretary will give me a list of their name and phone numbers, usually 10 days beforehand. And I personally will call every one of them so that I can get my arms around their story. And at the same time, have them ask questions of me. So when they do come to the seminar, we have a strong platform from which we can all move forward. Now, this is kind of interesting because you can see here that there were of that group who were adherent, 27 had been told they had to have bypass or stents. And when they go through the program, they no longer have to have that. Now, how many recurrent events did we see during this time? In the group that we were adherent, there was one event. This was a patient who was actually on a vacation in China, and he totally forgot all the rules, was eating off the economy, and he had a tendency to have high blood pressure. And with all that salt, his blood pressure went through the roof, and he had a small cerebellar stroke from which he recovered. There's a Of course, the patients who were not adherent, 62% of those 21 patients had disease progression during that period of follow-up.